Hey there, science fans! Today we're diving into the fascinating world of suppositories. Now I know what you're thinking. Suppositories? That doesn't sound very exciting, but trust me, these little guys are more interesting than you might think. In the simplest terms, a suppository is a medicine delivery system. It's a small, solid medication that's inserted into the body, typically through the rectum. Once inside, it dissolves and releases its medicinal payload. Think of it like a tiny submarine carrying a precious cargo of healing power. But why use this method instead of just swallowing a pill? Well, there are a few reasons why suppositories can be the superior choice for delivering medication. They offer a unique set of advantages that make them invaluable in certain situations. So, buckle up as we explore the intriguing world of suppository science. Now, you might be wondering, why on earth would anyone choose to administer medicine through the rectum? Well, there are actually some very good reasons for this seemingly strange approach. Firstly, suppositories are incredibly helpful for people who have difficulty swallowing pills or keeping down oral medications. This is especially true for young children, the elderly, and those experiencing nausea or vomiting. Secondly, suppositories deliver medication directly to the affected area, which can lead to faster and more effective treatment. This is particularly beneficial for conditions like constipation or hemorrhoids, where localized relief is key. Finally, suppositories bypass the digestive system, which means the medication is absorbed directly into the bloodstream. This results in quicker action and can be crucial for situations requiring immediate relief, such as severe pain or seizures. All right, let's talk about how to actually use a suppository. The process is simpler than you might think, but there are a few key things to remember for optimal comfort and effectiveness. Firstly, always wash your hands thoroughly with soap and water before handling a suppository. This helps prevent the spread of germs and ensures proper hygiene. Next, unwrap the suppository carefully and moisten it with a little bit of water-based lubricant. This will make insertion smoother and more comfortable. Now find a comfortable position, either lying on your side with your knees bent or standing with one leg propped up on a stool. Gently insert the suppository, pointed end first, into the rectum using your finger. Push it past the anal sphincter, about an inch or so for adults and half an inch for children. Finally, wash your hands again and relax for a few minutes to allow the suppository to dissolve. You might feel a slight urge to go to the bathroom, but try to resist for at least 15 to 20 minutes to ensure proper medication absorption. Section 4. The melting journey from solid to solution. Once the suppository is comfortably nestled inside the rectum, the real magic begins. The body's natural warmth starts to melt the suppository, transforming it from a solid form into a liquid solution. This melting process is crucial because it allows the medication to be evenly distributed and absorbed through the walls of the rectum. The rectum is rich in blood vessels, which act like tiny highways transporting the medication throughout the body. The type of base used in the suppository plays a significant role in how quickly it melts. Some common bases include cocoa butter, gelatin, and polyethylene glycol. Each base has its own melting point and absorption rate, which can influence how fast the medication takes effect. Section 5. Absorption and action: how suppositories work their magic. As the medication-infused liquid spreads throughout the rectum, it encounters countless tiny blood vessels lining the walls. These blood vessels act like eager sponges, rapidly absorbing the dissolved medication into the bloodstream. Unlike oral medications that must navigate the digestive system and liver before reaching the bloodstream, suppositories offer a direct route to the circulatory system. This means the medication can bypass the harsh environment of the stomach and reach its target destination faster and more efficiently. This direct absorption also means that the liver doesn't get a chance to break down the medication before it enters the bloodstream. This can be particularly beneficial for certain medications that are poorly absorbed orally or are rapidly metabolized by the liver. Section 6. Suppositories, a powerful tool in your medical cabinet. So there you have it, the fascinating world of suppositories. From their unique method of administration to their efficient absorption, suppositories offer a powerful alternative for delivering medication. While they may not be the most glamorous topic of conversation, understanding how suppositories work can empower you to make informed decisions about your health and well-being. Remember, knowledge is power, and knowing how your body works is the first step towards taking control of your health. So, the next time you encounter a suppository, don't shy away. Embrace the science behind this ingenious delivery system and appreciate the vital role it plays in modern medicine.